So we're going to get started. Good evening and welcome to Meet Our Pediatricians, part of Dartmouth-Hitchcock Health's Healthy Living series and presented in partnership with CHAD, the Children's Hospital at Dartmouth-Hitchcock. I'm Angelica Ladd, Community Relations Specialist at DHH and your moderator for the program. This evening, we will hear from two of our pediatricians representing the CHAD pediatricians in Concord, and I'm going to introduce them in just a minute. But first, we're going to do a couple of housekeeping items if I can get my computer to do what I want it to do first. So first, thank you to everyone who submitted questions ahead of time. And so we are going to work those questions into the program this evening. And if you have any questions throughout the program, please feel free to submit those using the Q&A function, which we will be moderating. And then we'll answer those either throughout the program or at the tail end. Tonight's presentation is being recorded and will be available at the Dartmouth-Hitchcock Health YouTube page later this week. And following the presentation, you'll receive a link for a quick survey. We ask that you complete the survey, which should take about 3 minutes or less, because it helps us with future Healthy Living series programming. Also, if you have any further questions, you could submit those through the survey. Just remember to include your contact info so we can follow up with you. All right, so thanks again for joining us. This evening, we have Dr. Caitlin Robator and Dr. Brittany Silva. Thank you both for being here.
Thanks for having me.
Yeah, and then so we're just gonna first get started by introducing yourselves. So if you want to just take a couple of minutes to talk about why you became a pediatrician, how long you've been with CHAD Pediatrics, and more important, probably most importantly, what your philosophy of care is. So Dr. Silva, we'll start with you.
Sure. So hi, I'm Brittany Silva. Just a little bit about me. I'm originally from Massachusetts. I spent my whole life in New England. I went to medical school in New York and then came back for residency training in Rhode Island and then moved up to New Hampshire. I have been at CHAD in Concord now since August of 2020, and I'm really loving it so far. And in terms of my philosophy of care, I would say I'm really all about getting the family's input when, going through a visit, whether it's a sick visit or a well visit. I love ending with the question. So what other questions do you have, or what more were you worried about today that we didn't get to talk about yet? Or even what do you think is going on is one of my favorite things to ask, because oftentimes you find the key to whatever the problem might be from just asking the families, hey, what do you think it is? And sometimes it's like, oh, it's right there. They know the answer. And so I really love including them in their kiddos' care in that way. And I've always wanted to be a pediatrician. So I really, since I was young, and I think because I valued my pediatrician so much and had such a close relationship with her, it was something I always wanted to be able to do for my future patients. But yeah, I really loved my pediatrician. So I think that was my inspiration.
Nice. Thank you, Dr. Silva. Dr. Robitor?
Hi, I'm Caitlin Robator. I started at Dartmouth in Concord in July of 2020, so almost 9 months now. And it's been a really awesome experience. I came from 7 years in Ann Arbor, Michigan, where I did med school and residency, but also grew up in New England, actually in New Hampshire. And so this has been kind of like a homecoming, which has been really awesome. Close to family, and my husband and I have 2 young kids, and so it's been really fun to be back home. In terms of what made me want to be a pediatrician, I was always so interested in science, and then realized that people were science too, and that was pretty awesome. And have had a really fun time learning about the human body. And then going through medical school, I really liked everything, but peds just like lit me up. It was so fun. You get to be with kids all the time and get to know their families, get to know the kids. That's one of the really awesome parts about being a primary care pediatrician, is that you see kids of all ages and you really get to know them and their families. And so one of the fun things that's happened so far is the babies who came in when I first started are now turning 9 months old, and watching them grow both physically and personality wise, and watching their parents, most of them first-time parents, becoming really awesome parents, getting to know their kids has been super fun. And that's why I do what I do and love what I do. So.
Awesome. Well, thank you. So we're going to talk a little bit about what family-centered care means. It's at the core of everything that CHAD Pediatrics does. And so, sorry, that's my 7-year-old. So it's at the core of everything that CHAD Pediatrics does. But Dr. Robitor, while the child may be the patient, parents are often referred to as partners in care. What does that mean to CHAD as an organization? And more importantly, what does that mean to you as a physician?
Yeah, and I think this is a great question, because I think Brittany and I both sort of alluded to it in our introductions, that, you know, we take care of patients because they're our primary patients, right? But parents know their kids the best. They spend so much time with them. They're there for their whole lives. And so they're such an important part of the care team. The care team at CHAD is really actually quite vast. I mean, you have your doctors, you have your medical assistants, you have your nurses, you have any subspecialists within the CHAD system who kids follow with for various reasons. And those are all the people who help to provide information to parents, who provide the services to parents, and help parents to be both advocates and also help parents to make informed decisions about the care that their kids receive. And ultimately, our job is to give you all the information you need to make the best decision for your child and your family. And I think that that's what being a partner in care is. We're all working together, and we all have the interest of, you know, the kids at the top of our list. And so I think that, you know, we really strive to give that to our patients.
Nice. Dr. Silva, do you have anything to add to that?
No, I think that was a great summary of what we stand for at CHAD. And I think some of the little bit that Dr. Robitor talked about with the CHAD community of subspecialists as well, I think is really wonderful what we have, and the wonderful collaboration we have with our subspecialists, and we can easily message our subspecialists and talk about kiddos and consult them and get answers for families quickly, which I think is a really great resource we have.
Wonderful. Thank you. So we have a few expectant families with us this evening. So we're going to cover a few questions about taking baby home and the appointments in the first year of baby's life. So we'll start with you, Dr. Silva. When should a parent or caregiver enlist the services of a pediatrician for their new baby? And how can they decide what pediatrician is the best fit for their family?
So I think it's important to start deciding on a pediatrician at least a couple of months before you're due to have your baby, because sometimes babies come a little early, as we know. But picking someone who you feel like aligns with your goals as a family, and someone that you feel like you're going to be able to have a great relationship with, because it's someone you're going to be seeing a lot in the first couple of months of your baby's life, maybe even more than some of your family. So in some ways, you'll see us a whole lot. So finding someone that you feel like you could connect with, and someone that you can trust. And it's just important to have someone in mind. And you know, once you're in the hospital after you've had your baby, that's when it comes time to set up an appointment for your first visit. Yeah.
Great. And then Dr. Robitor, could you talk about the well child visits in the first year? How many visits are there? How long are they? And how should parents and caregivers be prepared for those appointments?
Yeah, so there are quite a lot of visits in the first year. One of the first visits is shortly after discharge from the hospital. And we like to have babies, they're seen by a pediatrician in the hospital, but then we like to have them seen by someone once they're home. In Concord, in the Concord area, we actually have a really awesome resource, which is the visiting nurses. And they can actually serve as one of those first visits, and they see patients at their homes and look after both mom and baby. But we are in close communication with them, looking after things like weight gain, feeding difficulties, and in the first couple of days after discharge, that could be considered your first visit. If there are any concerns, we are always happy to see babies in the office, and some babies with certain medical problems or concerns we actually do want to see in the office first. But after that visit, we see babies at 2 weeks, making sure that everything is continued to go well. By that point, we expect that babies are getting in their groove. They're kind of feeding well. Mom and baby are getting to know each other, and dad are getting to know each other. And baby should be back to their birth weight by then. So that's one of the things that we're checking on. A lot of us will see or offer to see babies at 1 month as well, just to make sure things are going well. But that's not like one of the visits that definitely has to happen. It just depends on parents' comfort. And then we see babies at 2 months, 4 months, 6 months, 9 months, 12 months. And at each of those visits, we're assessing growth and development, and answering questions that come up for parents, telling them what to anticipate going forward. And each of those visits are usually a 30-minute visit, which gives us time to talk about the things that we need to check in on, but also gives us time for parents to bring up questions that they have. Sometimes parents will sort of note their questions down, and we'll work our way through that list. It's awesome to prepare something like that if you're thinking of it. Touch base with other caretakers. So like if kids are going to babysitters or staying with other family members, sort of collaborating in preparation for those visits, so we can get a really good picture of what's going on.
Nice.
Yeah.
Yeah, I actually had a visiting nurse come, and it's always so surprising to me is just how fast everything kind of goes. So I was in hospital in Concord, and I just called and I said, hey, the baby's here, and she had some like blood sugar issues, so they got us in like the very next day after I went home, and it was just so quick and pretty painless as a new parent. Or new again, I guess.
Yeah, I love that we have the visiting nurses for the baby's first homecoming, is what they call it, from Concord Hospital. And it's such a unique service just for babies born at Concord Hospital. And it's really, we're so lucky to have it, because it takes that stress away from families of having to pack everybody up, get in the car when you're 2 days, maybe 3 days after having a baby, when that's hard. And it gives families peace of mind of, someone's checking the baby and weighing the baby, and then communicating with the doctor, so we get all the feedback of what's going on at home, which is really great, because then we can give advice and talk about whether the baby needs to be seen sooner or whether we can wait until 2 weeks. And so I think it's really nice for families, and I wish it was everywhere, but we're spoiled and we're really lucky.
Yeah, it was really nice. Yeah. So we had some questions about immunizations. The immunization schedule has been something of a hot topic, especially in recent years, with the internet. So Dr. Silva, could you please talk a little bit about childhood vaccines? Why are there so many, and what is the typical schedule, and what, if any, are the exceptions?
Yeah, so it's definitely one of the things that I would say I talk about pretty frequently. Every visit almost, we talk about vaccines, starting from the first visit, just so that way parents know what to expect. So the first vaccine is given right after birth. It's hepatitis B, and that's the first vaccine against an infectious disease that a baby will get. And then they come to see us anywhere between 2 days old to 2 weeks old for their first visit. And we don't start the next vaccination series until 2 months typically. in the first 2 years of a kiddo's life, they'll be vaccinated against 14 different infectious diseases, which sounds like a lot, but in the spectrum of how many viral and bacterial infections are out in the world, it's just a really small portion. And the reason we vaccinate against that many, especially for a young baby, which I think is people's most common question, parents' most common question is, well, why when they're this little do they need that many? And I think the important thing to realize is that that's when babies are most susceptible to the harmful things, the harmful bacterial infections, the harmful viral infections that can severely impact their lives and sometimes even lead to horrible outcomes like death. And so that's the reason we give these vaccines at such young ages, is because it's when a baby's body is most susceptible to these infections. Babies' bodies work differently than ours. And so different barriers between their brain and their bloodstream are thinner, and they're just much more susceptible to getting really ill with something that might not affect us. Things like whooping cough and rotavirus and bacterial meningitis. So all of the vaccines we give are specifically planned out for certain times, and they are all studied together. So vaccines that we give together are specifically tested together for that reason, and to make sure that there's no harmful side effects when they're given together. So we follow the CDC guidelines. And so 2 months, again, is the first time that we give the first real round of vaccines. And there's 3 injectable vaccines at that visit and 1 oral vaccine. So 1 vaccine that's given by mouth. And then we repeat that at the 4-month and the 6-month visit. And then we get a little break, which is always nice for the 9-month visit. So that's a nice happy visit when the baby's playful and there's no shots and it's and then we start a new round against different infectious diseases at 1 year. And that's when you start to get the chicken pox and the measles, mumps, rubella vaccine. And then, they'll get sporadic boosters throughout the rest of their childhood, and like tetanus boosters and polio boosters and meningitis boosters. But really the core of the vaccines are given in the 0 to 2 year range. And that's very purposefully because it's when kiddos are most susceptible.
Okay.
Oh, and exceptions, that's the last thing.
Oh, yes, yeah.
So yeah, there's very few exceptions, I would say, for us to not follow the vaccination schedule. Some babies can't receive live vaccines, depending on if there's certain people in the household who may have certain diagnoses or illnesses, or if they've been treated with certain medications and they can't receive live vaccines. But there's only a few live vaccines amongst all of the vaccines we give. So I would say that's one of the few exceptions. And also for certain babies who are born very prematurely, they can't get vaccines at the same time sometimes as babies who are full term, and sometimes they can't get the certain live vaccines as well for a certain period of time. But other than that, there's really not too many exceptions, which we love because we want to vaccinate everyone we can.
Sure. Yeah. Thank you. So, Dr. Robitor, it's not a secret that many children are frightened by getting their shots. So what can parents do to help pediatricians out when it comes time to get the poke?
Yeah, so I think a lot of it depends on the age of your child, right? Because the developmental stage really plays a big role. So your 4-year-old knows what they're getting when they come to the doctor. And so, excuse me, helping them out by maybe preparing them for it and saying, hey, heads up, we're going to get shots and this is what it's going to be like, and sort of getting them ready for something. If that's the way your child works, some parents come in and they tell me, no, I didn't tell them at all. We're just going to do it. We're going to get it over with and it's going to be great. And so use your discretion as a parent to sort of know your child and know how they're going to react. Those are the 2 most typical schools of thought, I feel. Other things that we can offer when you're in the office, we have amazing medical assistants. They do this all day long and they're super at it. And so they're really quick. They get it in and out and they get the job done. They can, sometimes if patients are really nervous, they'll do they'll spray a little bit of cold spray on the arm, and it takes away, the shock of the pain. It distracts them by doing something else. We also have this thing called Buzzy Bee, and it's like a vibrating thing, and you put it on. It's a similar mechanism, just sort of taking the distraction and helping the kids in that way. Some of our older kids, I've actually worked with our behavioral health clinician in the office, who's a social worker, and she's done some exposure therapy with some of my patients to sort of, this is going to be something, blood draws, immunizations, those are lifelong things. And she's done some work with patients to sort of help get them to the spot where they can more easily get vaccines. And so I think that's been really helpful too. But overall, it's just got to get it done, and it's all for a good cause, right?
Yeah. Yep. Great. So we're going to switch gears a little bit now to illness and injury, because life happens, right? So Dr. Silva, there are times when a child is not feeling well or suffers an injury. So how should a parent decide between calling the office, visiting an urgent care, or heading straight to the emergency room?
That's a great question. I think there are some injuries that as a parent, like your gut instinct is going to be, we need to go to the ER right now. If there's a broken arm that's clearly broken, if there is an injury that is concerned, like a head injury where you're concerned about your child's mental status, or something like that, that is usually, as a parent, you have that gut instinct of we got to go, or call 911. But if there's anything in between that you're sort of questioning, does this need to go now? Can we watch this? Is this more of an urgent care visit? Can I see my pediatrician tomorrow or today? Always give us a call, and our nurses that we have at the office triage our calls, and they are fantastic. And they oftentimes, if they are unsure of, hey, can this wait? They'll come and grab us and ask us. So most of the time when you're calling to speak with our nurses, not only are you getting their fantastic advice, but a lot of times you're getting our advice through the background as well. And so I think that they can really help in sort of choosing the pathway of, what do we do now? Can we just watch this injury? Should we go get an x-ray? And I think most times, unless it's a concerning or severe injury, we'll try to get you in the office as soon as we can to see you, and sort of we can decide from there. But there are some things that our nurses are trained to talk you through over the phone and decide right there whether you need the ER or not. So we can always help decide, which I think is great, and can sort of take the pressure off of parents from having to make that decision in a moment that could be really scary.
Yeah. And Dr. Silva, over the past year, Dartmouth-Hitchcock and CHAD have expanded their telehealth services. And I'd like you both to answer this one after another, but could you just talk a little bit about what your experience has been with telehealth visits? Why would a family choose a telehealth visit? What would be a good appointment to have over telehealth?
Yeah, so I think, we all fell into telehealth under unfortunate circumstances, but it's actually been really helpful and useful in many ways. So in terms of how I use telehealth, mostly for a lot of psychiatric care, actually, not for first-time visits, but more for follow-ups for medications, where you don't necessarily need to see a kiddo in the office. Some medications, we do need to see you in the office at certain intervals of time to check blood pressures and weights and things like that. But there are some visits that are more of a check-in of how is school going when you're on this medication, or how are you feeling on this medication. So that's been something that I've used telehealth for. I think now that things are less intense and scary with COVID and more people are getting vaccinated, I think everyone feels a little safer going out, and especially to the office, where we clean things so much that we really try our best to keep it super sterile. So there are certain things that still are great and better to see in person, like rashes. Like you can see somewhat of a picture or see their skin, but it's always better for us to feel and see in person. So some stuff we definitely try to still get you in for, but telehealth definitely has a role And I think the subspecialists are using it a lot too, which is awesome. So there's a lot of families who may not have been able to go drive up to Lebanon or to Manchester to see a subspecialist at a certain day, but because they can do a telehealth visit as an initial visit, it's really opened up a lot of pathways for our families to access these subspecialists. It's been great.
Yeah, that's great. Dr. Robitor, how about you? How have you used telehealth?
Yeah, so I think a lot of similar ways that Dr. Silva is using telehealth. I've done a few visits for, parents who, type in a question through the MyDH portal, which is a wonderful tool. And it's a little bit more than just a response back. It would be great to sort of have an interaction about it, to watch a behavior that a parent is concerned about, or, to address a question that just takes a little bit more time and maybe would go a little bit better if you could talk to somebody face to face. And so we've done some telehealth for those types of things too, which I think has worked out pretty well. It allows us to see kids in their home environments a little bit too, which is kind of fun.
Yeah.
We've had some specialists who have, we do a little assessment in our office, and then we send them the information, but then they're able to do a lot of the counseling that needs to happen from their specialty through telehealth, kind of like Dr. Silva mentioned. And I think telehealth has been an awesome tool, just because patients are living all over the place, and it makes access so much easier to be able to do that.
Yeah, especially in the Concord area, because you probably serve a bigger swath of a rural population.
Right.
Yeah. So we're going to switch gears again a little bit to teen appointments and preparing for that transition to an adult provider. So Dr. Robitor, could you talk a little bit about teen appointments and what a parent or caregiver's role is in doctor's visits as they get older, and when it's time to talk about transitioning to an adult healthcare provider?
Yeah, so when kids turn 12, they get the DART screener, which is this tablet that has a bunch of questions for them. And it has things all the way from like nutrition and sleep to things like drugs, alcohol, things that kids are starting to see, unfortunately, at that age. And so they fill out all this questionnaire on the tablet, and then we're able to see their answers as they go. And oftentimes when kids are young, like the 11, 12, 13-year-old visits, parents are coming in with them, and they're like looking at their parents saying, I don't know what the answer to this question is. And so parents are often sort of pretty heavily involved at that point. But we always do take time to talk with teenagers and young adults on their own without parents in the room. And so I think that, as your child gets older, sort of preparing yourself to know that we might ask you to step out at some point during the visit, just to have a confidential conversation with your child, knowing that, if there are major safety concerns or if there are things that we need to talk about with you, then we'll bring you back in and we'll all have a conversation together. And so sort of transitioning from the role as the caretaker for your child to allowing your child to take ownership of their own health and sort of be the leader of that conversation. And oftentimes as kids are getting older, like 16, 17, they're coming in on their own and their parents are in the waiting room. And I'm like, did you come by yourself? Should we, follow up with your parents? One thing to know is that we always do need consent for vaccines for kids who are less than 18. And so it's really important for parents to be there for those things. But as kids get older, they really are taking that role. We see kids up to age 18 in our office, and sometimes like a little past their 18th birthday before they turn 19, until they transition over to another provider. People who transition over to like family practice, in the Dartmouth system, the providers are able to see the notes from all of their visits before, which can be really helpful. And can be kind of comforting to parents as they're sort of giving their child to an adult provider.
Yeah. Dr. Silva, do you have anything you want to add?
No, I think really across the board, we all ask families at some point or another to sort of split up during the teenage visits. I start personally at 13, and even just to ask kiddos, like, do you have any questions about your body that you might not want to ask in front of mom or dad? And it's actually, it's oftentimes surprising what kiddos will have to say or want to say to me or talk about. And so it's a great opportunity to get them to start to be in charge of their own health and their own body a little bit. And so I think it's a good step towards independence. So just expecting that, you're going to be asked to step out, but it's not going to always be for like super scary questions or anything like that. Sometimes it's just to chat and give us a little bit of alone time. So that way we can start to build that confidential doctor-teenager relationship that is super important to exist for us to take care of them the best way we can.
Thank you. So we touched on it just a little bit when we were talking about telehealth, but mental health for children, especially in the last year, has been a huge area of concern for many parents. And it's beyond the last year, but this year especially, right? So when should parents reach out to their child's pediatrician with concerns? And what are some signs of mental distress that parents should be taking seriously? And we'll start with you, Dr. Silva.
Yeah. So definitely the last year has been a really stressful year for everybody, and not just adults, but kids alone and young kids, even kids who you don't think might not be able to understand fully what's going on, but they're still feeling the effects and they know what stress looks like and what stress is, and it really trickles through and filters down to them. And so we're seeing a lot of issues with mental health this year in kiddos of all ages. And I think the best time to reach out to us to talk about it is the minute you are concerned about it, because I think across the board, we're seeing a lot of people say, okay, it's not that bad. We're managing it at home and everything is fine until it's not fine, I think is the big overarching memo I have is, things are going well until they're not going well. And so I think reaching out to us right away, and we can help with talking through next steps or potentially counseling, and really what to look for and things like that, and when to follow up with us, because starting before it becomes a true issue is, I think, the best way to sort of help the issue. And so I think things to look for families, and some of this is hard to tease out from normal teenage behavior, but sort of starting to isolate away from your family, withdrawing from things that previously were like the kiddo, your teenager was passionate about, or was doing all the time and was a source of fun, and sort of being more withdrawn and having less joy with things like that. But I think any concern at all, because your kid's best, so any concern that you feel like something may not be right or something may be different, I think it's worth coming in to discuss as a family. And again, you can expect at that visit that we're going to chat with everybody alone and together. So I always take time to talk with a parent alone and the kid alone and together. And sometimes it's even just great for the teenager or even pre-adolescent to use us as their mediator, because there's some things that they just can't get out and talk about with their family at home, or it's too uncomfortable. And so I spend a lot of time sometimes being the person that says, okay, well, we're going to talk to mom and dad about this today, and I'm happy to start the conversation. This is how we're going to do it. And a lot of times you can just see the relief in a teenager's face when you're saying, oh, I'm going to tell them, or I'm going to help you talk about it. And sometimes they just really need that. So I think it's important, if there's ever any concerns, to come in for a visit, because sometimes it just helps open things up and everyone feels a lot better.
Yeah. Dr. Robitor, do you have anything to add?
No, I think Dr. Silva hit it up.
Yeah. Yeah.
I would say that we have, we have a lot of resources. Right now, it's been really hard for kids to get into seeing counselors, which is oftentimes one of our first line treatments for some of the mental health issues that we're seeing. And so we can help jumpstart that process. We have an amazing resource specialist in our office who is always finding new people or new places for our patients to go. When we're sort of like, well, I don't know what the next step is, Emily is always like, well, try this, or have you thought of this? And so she's just another person on the team that's really helping to connect our patients with the resources that they need, particularly in the mental health realm.
Mm-hmm. Thank you for talking about that a little bit. And now we're going to talk about something that may be a little more of a tougher discussion to have, but it's on everyone's mind, COVID-19. And we've now seen the vaccines roll out to youth, with the Pfizer vaccine being approved for children, youth starting at age 16. So what do you think we can expect from the current vaccine trials on children younger than 16, and how soon do you think that they'll be able to get that vaccination? And I'll let whoever wants to take that one take it first.
So I would say that every day we're learning something new about COVID, and I think that's just really been the theme of COVID. It's not something anyone really has ever experienced before in our lifetime, and I think the vaccines came out and everybody's been getting them, which is really awesome. Now our 16-year-olds are able to get the Pfizer vaccine. And so we've had patients who we've, one other exception to the vaccination schedule, we're adjusting just a little bit, because if they're eligible for the Pfizer vaccine, they can't have had a vaccine within 2 weeks before that. And so if they come in for a well visit, we'll sometimes reschedule a visit for their vaccines that they were scheduled to get so that they can get the Pfizer vaccine. And so we've had patients who are all signed up and ready to go, which I think is awesome. I know that there are some trials going on for kids who are 12 and up. I think Pfizer's got, I think, a phase 3 trial going on for kids 12 and up. And I know that, both Moderna and Johnson & Johnson also have things in the works as well. I don't know that I can speculate about exactly when we will get a vaccine for kids, but I know that who are younger, but I know that they're working on it. And, we've had lots of parents call in and say, so what's the deal? And we're trying to distribute the information as soon as we get it. And so as soon as they're eligible, we'll let you know, we'll get people in, and we'll get everybody vaccinated.
So another really tough one, I think, is the post-vaccine social dynamics seem to be more confusing than the original social distancing guidelines, right? So if both parents are vaccinated, but their children are not, what should the social dynamics be? Can vaccinated grandparents hug and kiss their unvaccinated grandchildren? Can vaccinated adults mingle with other, and can their kids mingle together and play? How are you advising your patients?
It's a tough question, and I think for every family it's a little different. I've had families ask about, okay, me and mom or me and dad are vaccinated, now what? Because they have a young kid, and I think it's sort of for every family, it's going to be a personal decision. It's going to depend on, obviously the health of their kid. If they have a healthy kiddo with no pre-existing conditions, obviously that's less risky than having a kiddo who does have pre-existing conditions or has underlying health concerns. And I think that also applies to the conversation of which family members they see. So if you're going to see grandparents and grandparents have underlying medical issues and you're concerned, knowing that, even if they're vaccinated, there's still a risk of, we don't know as much as we want to know yet. And so there's still risks involved. But I think right now the current CDC guidelines, which I look at all the time because they change so much, but I think right now, and I don't think they specify specifically if there's a kid who hasn't been vaccinated in the house, but right. Unfortunately, but it says that if there is a family who has been vaccinated, that they can, or a household that has been vaccinated, they can mingle or socialize with a family who has not been vaccinated as long as they're low risk. And so I think if there's any concerns at all, wearing masks and hand washing, and trying to maintain some safer practices, even if you are together and not totally socially distancing, is always a good idea. I did it with my own family recently. And so I think there's, things we're still going to have to do while we figure out all of the nitty-gritty details and the questions that we want answered until kids and babies are approved to be vaccinated. So, and I think we're through the thick of it, and we just have a little ways to go and to hang on. But again, I think it's going to be family specific. So it's always worth you can talk to us about it. We can try to walk you through it. And a lot of us are just trying to talk through it just like now, because there is no easy answer.
Yeah. So I feel like the same for my family. Like, we'll be vaccinated soon. It's like the kids just want to get out of here.
Yeah.
We'll see. We'll figure it out. So, we have some parents of special needs children, and we had a question specifically about children on the autism spectrum. So, we'll start with you, Dr. Robitor, but could you talk a little bit about how CHAD Pediatrics helps these families and the services that we can provide?
Yeah, so I think starting from the very beginning, we screen for autism when kids are as young as 18 months. We do a standard screener at 18 and 24 months that helps us identify kids early. And I think that's really important for kiddos who are diagnosed with autism. And that sort of triggers a further workup, further evaluation by child development pediatricians who we have some wonderful child development pediatricians through Dartmouth. A lot of them are up in Lebanon. They are wonderful resources for the initial diagnosis. But then a lot of times kids with autism do end up requiring additional subspecialty services, whether it's purely focusing on speech and language development, the social skills acquisition, those types of things, or some of the other things that sort of come along with an autism diagnosis. Are there other underlying diagnoses like ADHD, anxiety? And we work closely with our other colleagues who sort of focus on those things to connect kids with the services that they need. I mentioned Emily Ramsey before, but she is our resource specialist in the office. And when a kid is first diagnosed with autism, she has this whole book of things that, of resources, of people she can connect kids with, whether it's ABA or speech and language or OT or PT, all of those things. And she just really follows them along all of the steps of the way, connecting with the school and helping to involve them in the process. And we as doctors, I've talked to the special ed directors at schools or the school psychologists to help really facilitate things to make sure that our kids with autism or other special needs are getting all the services, the wraparound services that they need. And so using our network to really support these kids.
Yeah, thank you. So I want to stress again, if you have any questions that you would like to ask either of our docs, if you want to just submit your question through the Q&A function, we are happy to take questions as well. And we have time to take more questions, but I did want to just end my series of questions that I have tonight with every parent, caregiver's best friend and worst enemy, Dr. Google. So many of us spend late nights on a phone searching for an answer to an odd symptom, a cough, a rash, sleep issues. So even when we know better, right? So many of us will land on a message board that has anecdotal advice at best. So could you please give us your favorite internet resources for those questions that keep us up at night? Where should we go first?
I'm laughing because I still do this as a doctor myself, and I know better, but I do it all the time for my own symptoms. So I think for kids, healthychildren.org, which is a website produced by the American Academy of Pediatrics, which is sort of our guru as pediatricians. It's the advice we follow, the guidelines that we follow. And so the healthychildren.org is a website for parents. And so it's just a wealth of information, but things are specifically written for parents to understand, and they have great handouts. And so I'll oftentimes refer families to that, especially when families will message, like Dr. Robitor had mentioned, but we have My DH, which is our messaging portal. And so families will write in and message us. And oftentimes it'll be non-urgent medical questions, but like teething or different questions like that. And I will a lot of times put links to healthychildren.org web pages, because I just think that they're a great wealth of information. They really summarize and give a lot of great tips and tricks. So that's one website I love and can pretty much answer most questions, I would say, that families have, and sometimes that I have. So it's great.
Yeah, I think that's one of my go-tos too, both as a parent and a pediatrician. I think that is safe and well research information. One of the other resources that we have here at CHAD is chadkids.org. And that's updated frequently and has a lot of different guidelines, like particularly about COVID. There are resources for families to help your child with their transition to living in COVID and those types of things. And links to other resources can be found there, and also something that we refer our patients to often. And then I think we're always happy to answer any questions, and so use us as a resource as well.
Yeah.
For sure. Yeah.
And also I would say I've had a lot of new parents who are social media savvy. And there's a couple of really great like Instagram accounts that I know Dr. Robitor and myself both follow for baby sleep and baby feeding and just development. And so a lot of times I'll ask families like, hey, do you have an Instagram? Because some families really like that as part of their day and something they can easily look at. And they're vetted. I would say, like, I agree with most of the advice they give, and so I'll recommend certain ones that I like. And so a lot of families like that as well. So that can be a conversation we have too.
Yeah. Right. Great. Well, it doesn't look like we have very many questions from the audience currently. So if you have any final thoughts before we wrap up on anything that we've talked about tonight, maybe something that we've missed, love to hear it. Dr. Robitor, do you want to start? Or
I was just thinking, I downloaded this app the other day, which I think parents might like. It's particularly useful for parents with young kiddos. It's the CDC Milestone app. And it's awesome because you can put in your child's birth date, and then at each of those visits, like you would typically come see the pediatrician, it gives you a list of milestones that we would expect kids to be sort of meeting at that point, and you can go through and you can click, and then at the end it tells you, is there anything concerning here? If you clicked these things, then definitely bring it up to your pediatrician. With each of those with each of the milestones, they have like pictures and videos of things, which can be really helpful, because when I say, can your child do the pincer grasp, you're like, what is that? But it shows a video of those types of things, and I think can be really useful, particularly if you're like worried about something or want to really keep track of those things. It's one that I just found and I really like.
Nice.
Yeah.
Dr. Silva, any final thoughts on anything we've talked about tonight? Or
no, I mean, I think if there's any questions or that you think of to ask your pediatrician, like, we're happy to answer anything. And I always tell families there's absolutely no dumb question. Like, every question is a good question that I've probably heard a million times before. So don't think you're the only one asking it. So I think that is oftentimes reassuring to families when there's a new baby and what is normal. And so I think anytime you have any questions or concerns, just always ask. It'll help ease your mind and get your questions answered.
Right. And you both have open panels currently. So you're accepting new patients at Dartmouth-Hitchcock Concord on 253 Pleasant Street. And we did have a question about whether or not Concord is open on the weekends. We do offer pediatric urgent care services at Dartmouth-Hitchcock Manchester on the weekends currently. So I just wanted to let everyone know that.
Yeah, and we are actually, we also are working in the Manchester office. So you may see your pediatrician in Manchester, or you might see a Manchester pediatrician. So you might see us.
Great.
Yeah. And I think one other really important thing is we are working during the week from like 8 to 6. We have hours in our office, but then we have 24-hour nurse triage. And so even when we're not in the office, there's someone there to answer your calls and answer your questions. So you could even call in the middle of the night if you're looking through and really worried about something. There are people there to help.
Awesome. Well, thank you both so much for your time and your expertise tonight. We really appreciate you joining us for the Healthy Living series. And we appreciate you for tuning in. Thank you so much. Please remember to fill out that survey that will come to you at the end of this webinar, or it will also come to you by email, I believe, tomorrow on a follow-up. But please fill out that survey. That'll help us with programming in the future if there's any special topics you would like to hear about in the pediatrics or any other health realm. We definitely look at those. And if you have any questions that you weren't able to ask for whatever reason tonight, you can also send those in on the survey and we will try to follow up with you. Just remember to put your contact information in there. So that's it for tonight. Thank you so much and stay healthy. Be well.
Thank you.
Thank you.